Back over to Lark.
Coming up next on Ask the Family Doctor, healing your aching back without drugs or surgery. Meet a doctor whose back pain even drove him to thoughts of suicide until he found a way to cure himself. We'll be taking your questions about your back pain as well. Then there's more to the difference between men and women's feet than just the size. And if you've got foot problems, we've got the answers, so give us a call about that also. Then later in our health headlines, what women need to know about their birth control. They may not be as foolproof as you think. Ask the Family Doctor is next. Hi everyone, and welcome to this edition of Ask the Family Doctor. I'm Dr. Walt Larimore. Well, we all have little aches and pains once in a while, and most of us can just grin and bear it, take a couple pain relievers, and move on with life. But sometimes pain can be so overwhelming for some people that it controls every aspect of their life. If you've had back surgery, you've tried all the drugs, and you've still found no relief, take heart. Our first guest has walked that path. He's been through it all. And he says that there's a way to heal back pain naturally. In fact, he's even written a book about his experiences, and he came to develop a mind-body program that works for him and works for others. His name is Dr. Art Brownstein, and he's the medical director of the Princeville Medical Clinic in Princeville, Hawaii. Art suffered excruciating back pain for about 20 years, became hooked on painkillers and endured dozens of surgeries before finally deciding to take control of his condition. If you have a question about chronic back pain or failed back surgery, now's the time to give us a call at 1-800-ON-HEALTH. That's 1-800-664-3258. Art, you can talk as an expert. You've walked it. You're a doctor, but you've played the patient route too. How did it get started? How did that back pain get going?
Well, it actually hit me in my 20s, my late 20s, my first year of medical school, and I was in a strange city to me, Philadelphia, and was having the worst winter in 25 years, and you know, medical school can be stressful, and I was playing basketball as a means of coping with that stress, and I came down for a rebound, and I could not straighten up. And I was 27 years old, and I went to the doctor, and I was given a diagnosis of degenerative disc disease at the age of 27. And
what did that feel like? Did you feel old?
I did. It was, you know, quite disheartening, and I was told that if I didn't learn to take care of it, I would end up on an operating table. And I started into a very gentle stretching and relaxation program based on yoga, and it was helping me. And I kind of left it when I entered the military service quite a few years later.
So went through med school, went through residency, right. Then got in practice, what, as a flight surgeon?
Right.
Okay.
Taking care of pilots, and, you know, fairly stressful, gearing up for war every day. And suffered some personal tragedy in my family. My folks passed away, and my brother died. And it took its toll on me. And even though I was training as a triathlete at the time, one day my back went out, and I did end up on an operating table. And now after my surgery, I ended up in worse shape. And,
so Art, that was just the first of several surgeries?
That was the first surgery for me, but I didn't do very well. And in fact, I ended up on pain medication. I was depressed. I couldn't practice as a physician for 3 years. And at the end of 3 years, I was offered another operation, and that was my real wake-up call. I remembered in medical school my professors saying, you know, physician, heal thyself. So I tried to seek an alternative way of healing, and I got on an airplane, and I traveled to other countries, and I discovered very ancient but very simple and powerful techniques, and that they worked, and I healed my back pain naturally, and I put them into a very concise step-by-step program, and that has worked for thousands of my patients as well.
Art, so many times when someone doesn't recover from back surgery, we in medicine blame the patient. We call it failed back surgery. It's really a label, isn't it?
It is, and I want people to know that there's a lot more they can do than just the conventional approach of drugs and surgery. You know, there's a saying that if your only tool is a hammer, you tend to see everything as a nail. And, you know, the orthopedic surgeons and the neurosurgeons, who are the specialists that are given the tasks of, you know, taking care of back problems when they get very serious, are surgeons. And
they live to heal by cutting.
Yes.
They heal by steel, as the stories say in school. I mean, they're surgeons. They love surgery.
Right.
And it's really what they know, isn't it?
Right.
And you're saying that surgery doesn't always work and can cause harm.
Surgery should be thought of as a last resort, not a first resort. There are times when surgery is appropriate. But even after surgery, there are things that people can do for themselves.
Not only can do, but really should do.
Yes.
If you look for surgery to cure your back, you're actually going to be in trouble.
That's right. And you need to take an active role in your own healing. And I want people to know that there are a lot of tools and resources within themselves. You know, Hippocrates said it thousands of years ago that natural sources within us are the true healers of disease. So I think there's a lot that people can do, and it's worked for me and thousands of others. And
Art, you say that back pain does not usually start with a single incident. It's not just a whiplash injury. I mean, medicine, most doctors ask those questions, but in fact, you say that's not the way it usually works.
The original title that I was thinking of for this book was The Straw That Broke the Camel's Back, because, you know, the final incident or injury, people injure themselves on the job just bending over to pick up a paperclip or to tie their shoes. Clearly that is not the the contributing element that does their back in. There is a whole lot more to the story. I want people to know that story, to understand their backs, and to understand how they can heal themselves naturally.
Let's talk a little bit about the injuries that occur. So often I'll have patients that come to my practice and they want to get that MRI scan, they want to get that CT scan, and I really resist that because I just know that the vast majority of the time that scan's going to be normal. Why is it that people are in so much pain, they've injured themselves, they've thrown their back out, they have sciatica, I mean, they are really hurting, but their scan's normal? Right. How do you explain that to people?
Because the overwhelming majority of the pain is coming from the muscle tissue, where the large majority of the pain receptors are located in the back. There's hardly any pain receptors in the bones, in the disc tissue. So when you take an x-ray, it shows the bones. When you take an MRI, it shows the bones and the discs. The muscles don't show up. That's where the problem is. What people don't realize is the muscles in the back are about 10 to 20 times more sensitive than any other muscle in your body. So when you tell somebody this is a muscle strain, these are muscle spasms that are causing your pain, they say, doc, I've been an athlete my whole life. I know what a muscle strain feels like. But not all pain is the same in the body. You know, when you cut your fingertip, it's much more painful than when you cut your arm. When you get dental pain, you know, from getting your tooth drilled, I know people that would rather have a broken arm than to go to the dentist. So not all pain is the same. The back muscles are exquisitely sensitive because nature has set them up this way as an early warning system. So understand that the pain is coming from the muscles, and the body is trying to tell you where the problem is. The muscles are the most important structure in the back. They help shape the bones, they move the bones, they determine the alignment of the bones. The disc problems and the other problems that end us up on operating tables happen much later. So
I almost think of those sometimes as red herrings that don't have anything to do with anything at all.
There are a lot of people out there with very bad looking MRIs and CAT scans and x-rays, and they're totally pain-free.
Let's make that point.
Yes.
Many, many people have awful x-rays and awful MRIs, and they have no pain at all.
That's right.
But if they were to pull their back and I was to x-ray them, I might mistakenly think as a doctor that was the problem. Is that what you're saying?
Could be also, yes. And there are people with normal x-rays that are in exquisite pain, as you mentioned. And what do we have to offer them? Well, if it's a surgeon, he'd say, I'm sorry, there's nothing I can do for you. And I want people to know that there's a lot that can be done for them, that they can stretch those muscles, they can strengthen them, and they can ease their pain with a very holistic approach. And
well, the Agency for Healthcare Policy and Research now has said that nobody should see a back surgeon until they've at least given themselves 6 weeks of conservative treatment. Why is that?
Because many of these problems will resolve without surgery. In fact, I had a good friend who was a physician, and he wanted surgery, and he called his spine surgeon friend at the Mayo Clinic, and the spine surgeon wouldn't touch him. He said, wait 6 weeks. If it's not resolved, then you can call me.
Do you think the back surgeons are beginning to learn a little bit?
You know, back surgeons are some of my strongest supporters for this program. They don't want to go to court. You know, back pain is a huge legal nightmare. All these cases that end up on the job and they end up in court, you know, they are very much supportive of an alternative approach that complements what they're doing.
Art, is what you're saying that this is one of those diseases, like diabetes, where the patient needs to take control. The doctor can help, but really the responsibility for taking care of back pain isn't going to lie with your surgeons and your doctors. For you, your back pain treatment lies on your shoulders. Is that what you're saying?
Yes, I want people to know they can heal themselves. I can't heal anybody. But Patients want this, but they want the information and the tools and the guidelines. They want to know a very safe and gentle yet powerfully effective program. If you can give them those tools, they're very happy. Most people want that information. They are tired of being passive recipients. If you look at the studies that show that people are going to alternative practitioners, it's staggering, the numbers. People are really fed up with just drugs and surgery and being passive recipients of
good
care.
reasons, especially if it's not working. And what good news it is that was something that is so common, so debilitating, a major cause of disability, that you have the power within you to find the help, to find the pain control, to find the healing that you need. Well, coming up in our next segment, find out more about how Dr. Brownstein's specific program works for healing back pain. And then in our health headlines, an unborn child may have a major effect on an adult with Parkinson's disease. I'll tell you how later in the program. Stay with us. You're watching Ask the Family Doctor only on America's Health Network.
Ask the Family Doctor on AHN.
Healing your back pain naturally. Hi, everyone. Welcome back. I'm Dr. Walt Larimore, and we're visiting with Dr. Art Brownstein. Art has written a book called Healing Back Pain Naturally. And he comes as an expert, not only as a physician, but one who has suffered from pain for 20 years in his back, who has failed surgery and has found another way to take control of his healing. Well, a lot of you have called in to talk to him, so let's go right to the phones, Art. First up, we have Michael. Hi, Michael.
Hi, how are you?
Just fine. Glad you called. How can we help?
Well, I was wondering if there were any surgical options to my condition. I actually have been suffering from back pain for probably 17 or 18 years, and about 3 or 4 weeks ago, I started having pain down my leg. Now it's to the point where my toes are numb. I had an epidural about 10 days ago. Doctors are saying that surgery is really the only option at this point.
And your question?
My question is, are there, for someone at this stage of the game, are there other options?
I think, Michael, that you'll be delighted that you called. Someone like Michael who is beginning to have signs of the pinched nerve.
Yes.
And a surgeon can come in and say, we need to do surgery. And it's a very, very powerful position to be in.
Right.
But in fact, almost no one in Michael's position has to rush to surgery. They can try other things first. What would you recommend for someone who's having back trouble?
Well, the first thing is for Michael to understand that what is causing the disc to herniate and to push on the nerve and give the sciatica symptoms. These muscles are tight and spasming in the back. They're compressing the vertebrae, causing the disc to bulge. So back up, get to the source of the problem. He's got to stretch those muscles, and not by bending forward, but by gently arching backwards. That will help to open the space between the vertebrae where the discs are. And many times just doing that alone will help that sciatica go away and take his pain away.
A recent study looked at chiropractic care, McKenzie exercises, which is kind of an extension exercise, and doing nothing, and found no difference. And so a skeptic might say, Art, exercise really doesn't do anything. But in your approach, it's much more than just exercise.
Right. That's only one component of the totality. So that would be the first step. Stretching can definitely help, and there's a lot more, even besides the McKenzie, that you can
maybe
do.
Not by itself, but
that's right.
As part of a program.
5 steps.
Okay.
That's the first step. Second step, stress management, because your brain is hardwired into those muscles through the nervous system. Learning how to relax, learning how to breathe, learning how to meditate, learning how to visualize, learning how to ask for help from a higher power. That will take all that tension and stress away.
Now, Art, I bet we've got viewers saying, whoa, I understand tension headaches. I understand neck tightness from stress. But low back? Are you serious?
Well, many people feel that when you try to carry the weight of the world on your shoulders, your back gives out. Learning how to eat right. If you're drinking too much coffee or smoking cigarettes, the caffeine and nicotine are central nervous system stimulants that cause those nerves to be excited and tighten down those muscles, which can cause your disc to bulge and end up on an operating table. Learning how to drink enough fluid and fiber, eat a well-rounded diet. People, studies are showing that we're eating way more junk food than we did, and these tend to be very low residue foods. They cause gas and constipation.
Now, the point of your book is, we've gone through this extremely quickly. No one could do it from just that explanation, but in the book you go step by step.
That's
it is a literal how-to.
That's right.
For someone like Michael, 17 years of back pain. Now, you had 20 years.
Yes.
How long should he work on something like this before he would expect to start seeing some results in general?
It depends on how long the problem has been there. It sounds like his sciatica
yours was
problem.
20 years, so how long did it take you to respond to this program?
It sounds like his sciatica is fairly recent in onset. So I would say that he would have a very excellent prognosis within a few weeks. He will know that he's on the right track. If he's getting worse and he's gotten no improvement doing all of these other modalities, within 6 weeks he should definitely get a second opinion or even a third opinion.
But your point is surgery is the last step.
That's
if you
right.
look for a cure in surgery, you may be looking for trouble.
That's right, and this is not life-threatening at this point. So certainly surgery can be helpful in life-threatening situations. He does have some time. He does need to work on these other, approaches, and I want him to know that there's a whole lot that he can do. He is not limited one-dimensionally to surgery, and that's it.
Boy, I couldn't agree more. Art, great advice. Michael, give us a try. Towards the end of the segment, I'll give you a number where you can call to get more information on Dr. Brownstein's program. And I'd love for you to call back 6-8 weeks. Let us know how you're doing on one of our open call nights. Let's go next to Dee. Hi, Dee.
Hi, doctor.
What's on your mind?
Thank you for calling me.
Or what's on your back?
Okay. I had back surgery February 12th of this year.
Okay.
I was off work for 6 weeks. I did fine. It was like a miracle surgery. It started out where I had not only lower back pain, but it went straight down to my ankle on my left leg.
All right.
I went back to work. As soon as I went back to work, the end of that first week, I got the pain right back. Now I have a constant Charlie horse.
Okay.
I have to mention to you, when I had my MRI, it showed a cyst and spinal stenosis.
Okay, Dee, I'm getting the picture. What's your question for us?
Okay. He took the cyst out, and he took a part of the vertebrae. I was wondering if this pain is caused by the stenosis, or is it just a result from maybe overwork?
Let's talk about it. Let's talk about it, Dee. Art, it's not an uncommon problem. In my practice, if I have someone who does go through surgery, if they get back a little bit too quick and injure themselves in the healing process, it's almost like they're back to peg one. The surgeon kind of wants to go back to do more surgery.
Right.
You might say there's another option Dee might want to consider.
Yes, unfortunately, this is a common story, and even the neurosurgeon friends of mine, complain that their patients are being ordered back to work too soon. So even surgeons realize that there is a certain time element required for healing. I think that with each surgery, there is a chance of disruption of the normal supporting architecture of the spine. So she definitely needs to rest. She needs to work on the other options, which would include stretching, strengthening, relaxing, stress managing, watching her diet.
I'm going to stop you because you said something to me that's crucial. You said she has to work on, and that's really an important part of your program. This is not a pill you take. It's not surgery. It's over.
No.
This really is work. This is going to cost people time, effort, dedication, and if they're not willing to take care of themselves, their back's not going to take care of them, is it?
No, but I want Dee to know that this is not something that's going to have to totally rearrange her life. These are easily doable methods that she can incorporate into her already busy lifestyle. But as you pointed out,
Not by adding more, but by being wiser with what you
and
do?
becoming more aware of the needs of her back. What does her back require? And not to be passive about it. And I want her to know that she has the power to heal herself. She doesn't have to keep running to the surgeon for her pain. She can learn to listen to her pain. The pain is a message from her body that's trying to get her attention. Her body wants to be healthy, happy, and strong. She can work with her body and her mind with very simple approaches, and she can heal her back pain naturally.
It's a very, very important message. It's one that's not been given often enough. Art, I'm glad you came by to give it to us, and I hope you'll come back again soon. Thanks for being here.
Thank you so much, Walt.
By the way, if you want more information on this, what shouldn't be, but is revolutionary program, why not call Dr. Brownstein and get more information on his program at 888-851-3586 for information on healing back pain naturally. That's 888-851-3586.